that? If you don't have loved ones and you want to age in place, you do have to rely on government services. So what is the state of the union when it comes to that?
It's iffy. The more diminished you are, the more hours you would get. But certainly there was a wait list. I did a story in 2022, and the wait list for home care at that time was about 20,000 people, the majority of which were over the age of 60, waiting for home care services. So you could get, if you had significant cognitive decline, even with a family caregiver living with you, with a spouse, you could get, say, 10 hours a week or 24 hours a week, but that is not enough to help that caregiver support them. They become very diminished as well. It's very difficult.
It's very hard on them. All right, so Maria, you say the most realistic and promising solution for aging in place are something called NORCs, and that stands for Naturally Occurring Retirement Communities. What exactly does that look like?
That is not a pre-built retirement home. It's not a pre-built community aimed at older adults. It's an apartment, a condo, or even a neighborhood where it's multi-generational, but people have just aged in place. So there's a preponderance of older adults there. And for a story that I did in 2022, I went to New York City, where they originated in all their co-op buildings, and they provide, so they bring in government-paid supports. They have legislation from the state and the city, and they send in an executive director to organize the supports. They have social workers, they have nurses to do health promotion work. They bring in the community to help people with isolation. And what they found, and why the government continues to fund it, is that it saves them money. People are not going into hospitals. They're not going into nursing homes to the extent that they might have. They're able to age in place.
Love that.
All right, and we're also seeing NORCs. Are they being adopted here in Canada, those NORCs?
Yes.
Okay,
yes.
Good.
Slowly but surely. Queen's University in Kingston is working with Oasis organization, and they have initiated several NORCs in apartment buildings in Kingston, and they're working through a few in Ontario and Vancouver. And University Health Network and the NORC Innovation Center is also starting research and